Commissioner Bledsoe, you want to ask a question.
Thanks, Mr. Chair. So, if the chair will, I just want to make one comment and then ask a question. The comment is simply that this is great timing because next week, Dr. Lyman Chin from Stanford's Hoover Institution will be presenting to the task force. We have some members of this committee who are also on the task force, and we're going to have an entire hour probably presentation from Dr. Chin about this. So the timing's great to get this report back from PCG and from this committee. But the question I have, and I will direct it to Rich, but also Cheryl, if you want to weigh in on this, that's great too. And it's more of a political question because there's been a lot of discussion outside this committee, but it's also kind of your perspective on this. What's fascinating to me about this 1332 waivers is how it's being touted by both sides, which is really unusual, especially in this contentious healthcare debate that we're going through. Both sides are saying that 1332s are good. So you have clips of President Obama saying, you know, this is a good thing to have these 1332 waivers in the Affordable Care Act. You have John McDonough, who's a former aide to Teddy Kennedy, who wrote a paper saying that the 1332s are state innovation on steroids, and so advocating for 1332s. But then on the other side, on the conservative side, you have experts like Stuart Butler, 30 years at Heritage Foundation, who works at Brookings now, who's written extensively about the 1332s, and then Dr. Chin, who's also a more conservative thinker on this, also saying that 1332s are good. So, you know, as best you can, I guess my question is this: if both sides are saying this is good, who's right on this, and why do you think there's this agreement, especially in an area that's potentially so contentious? I mean, is it, you know, one side says, well, I don't trust the 1332s because I don't like the Affordable Care Act and the president's in favor of this, he's trying to slip something in that I don't like, and then the other side is saying, well, I don't like the 1332s because they're trying to undo Obamacare and I'm in favor of the Affordable Care Act. So who's right? Why do you think there is this agreement? Could you just maybe weigh in on that from your perspective?
The short answer is yes.
They're both right.
They are both right. And actually, we'll, you know, I plan on talking a little bit more about this. When we look at some of the alternatives to the Affordable Care Act that are percolating up, they're not too different than what states are considering under 1332 anyway. I was in on a call with Dr. Butler and with Grace Marie Turner and also John Burtko. So you have the left and the right and the far right on that call, and it was on regarding 1332 waivers. And the one who was the farthest right said, and this was a quote, 1332 waivers, dare I say, make the ACA acceptable for conservatives. And I have not heard anyone yet say, oh, you know, I don't want this kind of flexibility in my state. Whether you're left or you're right, you want what you want. And so I frankly haven't heard anybody say this is a bad idea. Rich is exactly right too in this, regarding this issue of budget neutrality. What can be counted toward that neutrality? That's a huge issue because it could be the entire federal spend in your state. So there's lots to be negotiated on this, but and will it be challenging? Absolutely. But wherever there's a challenge, there's an opportunity.